We usually start with what I call rate control because with patient with atrial fibrillation, the heart rate usually goes very fast. So we would use something commonly called beta blocker or calcium channel blocker to control the rate to minimize the symptoms. However, the risk of stroke remains the same because the patient remains in atrial fibrillation. So we would really like to have medication or treatment to get patient back into normal sinus rhythm. Currently, there are some what I call anti-arrhythmic drugs that we can use to treat patients to minimize the atrial fibrillation. But currently, the understanding is that with the atrial fibrillation, the rhythm or the abnormal rhythm starts in the pulmonary veins, which are the veins that drains the blood back to the left atrium. So when the irregular rhythm starts in the pulmonary vein, eventually it goes to the left atrium and causing the heart to fibrillate. So with catheter ablation is that we would be able to pass a catheter up to the left atrium, and then we electrically isolate the pulmonary veins. And the way we do it is basically making a circle around the pulmonary veins. So again, that would allow us to electrically isolate the pulmonary vein. So despite the pulmonary veins might still have the abnormal trigger or abnormal stimulus, but it would not be able to go into the heart and cause the heart to fibrillate. We would like to do things that minimize any stimulation of the heart. So there are some minor things that patients can do, such as decreasing alcohol intake, decreasing caffeinated products, decreasing stress. All of these things that we can do should be able to minimize the trigger point of atrial fibrillation, and together with the treatment, and hopefully that's enough to control someone's symptom.